Is it possible to detect an impending stroke in advance? And what risk factors for stroke depend on the individual? Today we will answer these questions and tell you about a useful test for identifying pre-stroke conditions. Why strokes happen? The main reason for this terrible condition is the blood pressure. If the blood pressure rises or falls, blood vessels can spasm, which prevents the flow of oxygen to the brain. As a result, the person loses speech, the ability to move limbs, and sometimes even chew and swallow. The degree of damage to the brain and nervous system during a stroke can be very different. The ability of the person to recover and the speed of recovery also differs. But there is one general rule: the sooner a stroke is treated, the greater the chances of full recovery. It is believed that if a stroke victim is taken to a medical facility within an hour and first aid is given, the risks of complications are relatively small. But in the case when this time interval is missed, the condition worsens dramatically. In order to seek help in a timely manner, it is necessary to understand how to recognize a stroke. The FAST test. American scientists have developed a simple test to determine impending stroke at home. If your relative or you felt bad, pay attention to the following signs. Firstly, the symmetry of the face. If the smile does not raise one side of the lip or drooping eyelid, it is a sign of lesion of the facial muscles. Secondly, try raising two hands at the same time and keeping them at the same level. If there is a problem with this, it also indicates a stroke. A third sign is slurred speech, and another is decreased sensitivity, where the person does not feel other people's touch as clearly. If you have these symptoms, you need to call an ambulance immediately. These are indicators that a stroke has either already happened or it's already happened. However, there are signs that tell you in advance about the impending disaster. They do not appear immediately before the stroke, but a week before it. Firstly, there is a disturbance of coordination of movements and motor skills. Things fall out of your hands. It becomes difficult to keep your balance, and the sequence of simple actions is confused. The second sign is constant dizziness. And the third is a disturbance in the clarity of vision, i.e., objects become dark, not clear enough, space trembles or floats. Traditional medicine does not lose its relevance. We try to popularize its recipes and methods and invite you to subscribe to the channel to always be aware of important information about recovery. Risk factors. Neurologists note that the impaired blood flow as a result of the development of atherosclerosis of the vessels, the body can compensate by creating a system to bypass the blocked areas, but this is possible with the gradual development of the disease. However, even in this case, although strokes usually do not occur, there are problems of chronic damage to the cardiovascular system, which still increase the risk of heart attacks and strokes in the future. Factors in the development of this state of the body are certain diseases, most importantly hypertension and diabetes mellitus. With the first disease, pressure can lead to regular crises, and in itself its strong fluctuations reduce the elasticity of blood vessels. It is especially dangerous if the pressure is uncontrollable, i.e., standard hypotensive drugs do not work. Diabetes disturbs the metabolism, so not only glucose but also fat is poorly absorbed. Their deposition provokes narrowing of the vascular bed, and this is followed by an increase in pressure and deterioration of blood supply to internal organs, including the brain. Risk of stroke significantly increases bad habits, poor diet, and excess weight. All these factors are interrelated, because abuse of fatty and fried foods leads to the deposition of harmful cholesterol in the blood vessels that inevitably leads to atherosclerosis. It is a disorder of the cholesterol metabolism is the main cause of the disease. Among the bad habits, it is especially worth mentioning the abuse of alcohol. because any alcoholic beverages lead first to a sharp dilation of the blood vessels and then to their sudden spasm. This worsens the overall condition of the vascular system and increases the risk of developing a stroke. But since all these factors are due to the actions and habits of the person himself, he can correct his lifestyle and avoid the terrible consequences for his health. But how do you protect yourself from the risk of stroke? Share your helpful tips in the comments.